You have an upcoming presentation at work, and you start feeling overwhelmed with feelings of inadequacy and fear of criticism. What would Karen Horney suggest about these feelings? A. They stem from unresolved conflicts during childhood, particularly related to your relationship with your parents. B. They are a result of your unconscious desire for attention and approval from your colleagues. C. They are indicative of a basic anxiety stemming from the threat of being isolated and helpless in a potentially hostile world. D. They are a manifestation of unresolved Oedipus or Electra complex issues. C. They are indicative of a basic anxiety stemming from the threat of being isolated and helpless in a potentially hostile world. Karen Horney proposed the concept of basic anxiety, which is a pervasive feeling of loneliness and helplessness arising from a child's early experiences. This anxiety persists into adulthood and influences behavior, such as feeling overwhelmed or inadequate in situations like presenting at work. According to Horney, which of the following is not considered a coping strategy in response to basic anxiety? A. Moving towards others, compliance. B. Moving away from others, detachment. C. Moving against others, aggression. D. Moving parallel to others, concordance. D. Moving parallel to others, concordance. Karen Horney identified three main coping strategies in response to basic anxiety: moving towards others, compliance; moving away from others, detachment; and moving against others, aggression. However, moving parallel to others isn't recognized as a coping strategy in her theory. You have a friend who often complains about feeling insignificant and unloved, despite having loving and supportive parents. How might Karen Horney explain this discrepancy? A. The friend may have repressed memories of traumatic experiences with their parents. B. The friend might have unresolved unconscious conflicts with their parents, leading to feelings of inadequacy. C. The friend's parents may have used conditional love, leading to feelings of insecurity and worthlessness. D. The friend's feelings are likely a result of an unresolved Oedipus or Electra complex. C. The friend's parents may have used conditional love, leading to feelings of insecurity and worthlessness. Horney believed that inconsistent or conditional love from parents could lead to feelings of inadequacy and insignificance in children, even if the parents were outwardly loving and supportive. This can result in neurotic behaviors in adulthood. Your partner frequently criticizes you, which makes you feel anxious and defensive. According to Horney's theory, how might you respond to this situation if you tend to move against others? A. You may become aggressive and confrontational, escalating conflicts. B. You might withdraw emotionally and physically from the relationship. C. You could become overly compliant, seeking to please your partner at any cost. D. You may seek emotional support and validation from friends and family. A. You may become aggressive and confrontational, escalating conflicts. According to Horney, individuals who move against others tend to respond to criticism or perceived threats with aggression and hostility. This can lead to conflicts and further exacerbate interpersonal problems. You notice that a colleague constantly seeks reassurance and approval from others, even for minor decisions. How might Horney classify this behavior? A. The colleague is exhibiting a neurotic need for affection and approval. B. The colleague is engaging in neurotic pride, seeking to appear superior to others. C. The colleague is expressing neurotic demands for power and control. D. The colleague is demonstrating healthy social behavior, seeking input from others for decision-making. A. The colleague is exhibiting a neurotic need for affection and approval. Horney identified several neurotic needs, including the need for affection and approval. Individuals with neurotic needs excessively seek reassurance and validation from others to alleviate their underlying anxiety. You realize that you often find yourself seeking reassurance and validation from others, even for decisions you know are inconsequential. According to Horney, what might be a productive approach to addressing this behavior? A. Exploring your childhood experiences and relationships with caregivers to understand the root of your insecurity. B. Suppressing these feelings and focusing on self-reliance to overcome dependence on others. C. Engaging in aggressive behavior to assert dominance and reduce feelings of vulnerability. D. Ignoring these feelings and distracting yourself with other activities to avoid discomfort. A. Exploring your childhood experiences and relationships with caregivers to understand the root of your insecurity. Horney emphasized the importance of self-awareness and understanding one's early experiences to address neurotic patterns of behavior. Exploring childhood relationships can help uncover the root causes of insecurity and dependence on others. How might Karen Horney view traditional gender roles and their impact on personality development? A. She might argue that traditional gender roles reinforce feelings of inferiority in both men and women. B. She might suggest that traditional gender roles provide a sense of security and stability, reducing anxiety. C. She might believe that traditional gender roles are essential for healthy development, providing clear guidelines for behavior. D. She might propose that traditional gender roles contribute to neurotic behavior, particularly in women who are expected to be passive and submissive. A. She might argue that traditional gender roles reinforce feelings of inferiority in both men and women. Horney criticized traditional gender roles for perpetuating feelings of inferiority and insecurity, particularly in women who were expected to be passive and submissive. She argued that these roles contribute to neurotic behaviors and hinder personal growth. You seek therapy to address feelings of inadequacy and anxiety. Based on Horney theories, what might be a central focus of therapy? A. Exploring early childhood experiences and relationships with parents to uncover unconscious conflicts. B. Analyzing dreams and unconscious desires to gain insight into underlying psychological issues. C. Challenging irrational beliefs and cognitive distortions that contribute to anxiety. D. Utilizing behavioral techniques to modify maladaptive patterns of behavior and thought. C. Challenging irrational beliefs and cognitive distortions that contribute to anxiety. Horney advocated for psychotherapy approaches that focused on challenging irrational beliefs and distorted thinking patterns that contribute to anxiety and neurotic behaviors. This might involve cognitive restructuring and exploring alternative perspectives to alleviate anxiety. Critics argue that Horney's theory lacks A. Clarity and precision in defining key concepts. B. Empirical support from research studies. C. Practical strategies for personality assessment and intervention. D. Consistency in its explanation of personality development. A. Clarity and precision in defining key concepts. Critics argue that some of Horney's concepts, such as basic anxiety and neurotic needs, lack clear and precise definitions, making it challenging to operationalize them in research and clinical practice.